Hello, hello. Hi, everyone. Today is Wednesday for women, and today is we are going to talk about PrEP for women. Thank you for people who is join us now. Hi. So as you already know, my name is Lissa Alfaro, and I am community health educator here with Whitman-Walker. And today is again Wednesday for women. And the topic for today is gonna be for PrEP for women. So, and as you already know, over the past few months, the community health department has expanded its outreach effort to the social media platform. To we cover various topics on HIV and STI, sexual health practices, access to care, social determinants of health, and general public health intervention. So the next series of our research we focus on the current pandemic COVID-19 and ways to manage your sexual, personal, and mental health. So the community health team is here to educate and support you. Hi, Kevin. Thank you again. We are going to wait for some people to join us here, and to remind you about how to get a free HIV and STI testing. You can just call us at 202-787-4439, and we are here to support, to make an appointment for you if you want to get the screening with us. We are just happy to help with anything you need here. So talking about the topic for today, do you know certain people have a higher chance of contracting HIV than others? So today the topic, as I told you already, is PrEP for her, and that's why now there is PrEP for her. So PrEP for her is a campaign initiated by empowered women to be 100% in control of their sexual health. So since certain of group of disproportionately affected by HIV, PrEP is for her is a way for women to lower the chance to contract HIV by 90% of more. So what PrEP mean? PrEP is, as you already know, post-exposure prophylaxis. So we are going to spread what the words means. So PrEP means before, exposure mean coming into contact with HIV, and prophylaxis means treatment to prevent an infection from happening. Mean having sex with someone who you think can have the HIV infection. So PrEP is just a pill that you can take daily to reduce your risk of contracting HIV. It can be up of 90% effective in preventing HIV transmission through sex, or 70% effective if preventing HIV transmission through injection drug use. So the brand name is Truvada, and as you already know, also it's a pill called Discovery also. So Orlando, hola, corazón. So when is PrEP effective? So if you have anal sex, PrEP needs to be taken constantly for 7 to 4 days to be fully effective. So 7 to 4 days is the time or the frame to it stays to PrEP to present in the anal tissue if you have vagina, need to be taken consistently for 20 days straight to be fully effective. So 20 days is the time frame is take for PrEP to present in the vaginal tissue. So how I know if PrEP is right for me? So you may want to be considered to take PrEP if you don't always use condom, external or internal, when you have anal or vaginal sex. You don't always ask your partner to wear a condom. Also, if you have been diagnosed with a sexually transmitted infection or STI in the last 6 months, if you are unsure of HIV status of your sexual partners, if you are in a relationship with a HIV positive partners who may or may not be on HIV treatment. So if you are a person who inject drugs or you are in sexual relationship with a person who inject drugs too. So if you are already negative and interested in PrEP, if you have sex with multiple partners, if you worry about getting HIV affect your enjoyments of sex, if you worry about getting HIV spot you from having sex you want, you change your sex partner frequently, if you partners are known also picked to have other partners, or if you are traveling to other countries with higher HIV prevalence or have sex with other people you meet there. So PrEP doesn't not prevent STI. As you already know, PrEP is a pill used to help people to prevent HIV, but PrEP does not prevent other STI, which means when taken correctly, PrEP is effective in preventing HIV only. So PrEP can be used with other HIV prevention methods, or it can be used on its own to prevent HIV. So PrEP does not prevent other STI like chlamydia, gonorrhea, or syphilis, and PrEP does not prevent either pregnancy. So PrEP can be used with another STI prevention method as well as a method of contraception, and means saying that PrEP is just helping us to avoid or get HIV through sex. So it's saying too that PrEP just prevent HIV but no STI. That's why we need to know if we are going to start taking PrEP. We need to know we also have to be include condoms and lube to have better sex in that way you cannot be like scary to have any be in touch with any HIV or any STI. So also, can you take if alongside other treatment? Yes, PrEP can be used alongside transfolk hormone treatment without changing its effectiveness. Means you can continue. You can start taking PrEP if you are trans folks, and you PrEP doesn't mean that you need to stop your hormone therapy. Means you can combine both medication, and it's not to be like any change of effectiveness for both medication. So for trans women, this means you can take your feminizing hormone treatment without worrying about it's being affected by PrEP. So this is super important because trans women are one of the groups more affected by HIV around the area. So PrEP can be also taken with all contraceptive methods too. So and how to access to PrEP for women. To access PrEP to PrEP, you can do it here with Whitman-Walker Health, and you can just call 202-797-4439. This is the PEP line. Also, we are we are doing HIV and STI, but that line too. So you can use combine to make an appointment. Also, to if you have any question about PrEP, also you can use call us at 202-939-7690. Um, then we can collect some basic information about you. Have you seen sign a registration form, and they can you educate you to meet with a medical provider to see if you qualify or not to start taking the medication known as PrEP. So comparative data about men and women on PrEP. So why are no more women on PrEP if they are new and emerging high risk population for HIV? So while the numbers of newly diagnosed HIV cases continues to grow among women, especially women of color, studies have found that this group have a low of perceiving risk of contracting HIV. So most PrEP advertisement is between poor men in general. So specifically for MSM. So even Discovery PrEP newest version, I mean Discovery PrEP newer version claims it's not safe for women because it's not enough information is no about the drug and is the rash interaction with female body system. So how many people are enrolled in PrEP in DC? So there is a very high number of people using PrEP in DC. So however, most of the people on PrEP are men. So in the last study we got the information was in 2019, and there were 3,619 PrEP users. 92.8% were men, and why 6.2% were women. So mean women is really really low. So that mean we need to get in touch and get more information if we already know we are having many partners, or if we know our partners are with other people. So means you can get the medication through your doctor. It's just simple like a phone call and connect with us, and we are here to help you. Remember, the phone number is 202-797-4439, and we can give you any advice, any more information over the phone. So this is the information I have for today. But before I go, I wanted to give you a few reminders about the COVID-19 vaccines and site vaccination. So if you already gotten vaccinated, congratulations. You have been taking a really important step to prevent yourself, your loved ones, and your community from illness. So remember also Delta variant is also across the United States, and at the moment, and it's totally understandable why you maybe want to keep wearing your mask on. So the vaccine, as we already know, is not 100% effective, and more contagious variants are here around us. So protocols in place to actually verify that for around you are vaccinated, and keep on staying alert too. So if you have not been vaccinated and you are looking for an appointment, here at Whitman-Walker, we are providing the COVID-19 vaccine. If everyone age 12 and up are eligible, and to receive the Pfizer COVID-19 vaccine, and everyone ages of 16 and up eligible to receive a COVID-19 vaccine as well. So please reach out to us at 202-207-2480 to make an appointment with us. And if you are having trouble making an appointment with us, you can, call the main number 202-745-7000, and people from the call center can transfer you to the line who can help you to get appointment to get the COVID-19 vaccine. So remember also for DC resident, if you can find information on COVID-19 vaccines, welcome location and eligibility remember, you can just Google it to vaccinated.dc.gov or by calling 1-855-6363 or 333 and track the spread of COVID-19 vaccination lines by visiting also coronavirus.dc.gov. Don't wait. So also for Maryland residents, learn more about the Maryland vaccination distribution process and scheduling a vaccination appointment you can go through Google to covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George County, please you can visit their vaccination registration portal here in marylanddc.gov. Also, if you live in Montgomery County, you can visit the vaccination registration portal here. Also, you can call them at 240-773 or 311 to schedule an appointment with them. And also for our Virginia residents, you can learn more about Virginia vaccinated distribution process and schedule a vaccination appointment at vacinate.virginia.gov. And also calling 867-829-4682. So remember also, if you have not been vaccinated yet, if you are looking for an appointment, please continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and remember, it's very important that you get the vaccine. Discuss COVID-19 precautionary measures with those around you. Be mindful of mask keeping your distance, specifically if you don't know the other people's status. So also, if you want to support Whitman-Walker WAC, you can register to it's going to be registered to WAC, run and donate this year virtually WAC of 5K to end HIV on Saturday, October 23rd. And this year make a special year is the 35th anniversary of WAC. So you can register yourself or your team today at walk2endhiv.org. And also remember to follow us on Instagram, Facebook, and Twitter, and at Whitman-Walker, and checking our website at www.whitmanwalker.org, and for more up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. And also reminding about our follow our program are at Real Talk DC, at No Filter, and at The Corner DC. And let's see who is here. Hermanita Fernanda, mi amor, ¿cómo estás? Hi. Great, Lisa. Thank you. For people who joined today us here, and there you can see our website, and just to remind, if you want to get an HIV and STI testing, remember it's by appointment only, and you need just to call us at 202-797-4439. If we cannot get your phone call, you can just leave a voicemail, and one of my coworkers or myself is going to call you to help you to schedule an appointment to get the HIV and STI screening. Remember, everything is for free, and you don't have to be worried about pay anything. So for today is everything I have. Thank you for being here every Wednesday with me, and thank you for support me, and support Whitman-Walker as well, and to all the people who are here, thank you for being here tonight, and I hope to see you next week with another great topic. And remember, just if you have any question or anything, you can use call us on the main number 202-745-7000. You want to make a medical appointment, you can call the number too. The last reminder is about HIV and STI testing by appointment only. Remember, please call us at 202-797-4429. And this has been all for tonight. And I hope to see you next Wednesday with a great topic with myself and my team. Thank you again, and have a great evening. Bye bye. Oh, and happy September month. Bye bye.